Welcome. I'm Dr. Crystal Foster, here with your Baylor Healthcare System Spotlight on Health as we take steps to get healthy, Texas. Today, our focus is on women and heart disease. Joining me is Dr. Monhan Sathyamoorthy. Thank you for joining me.
Thanks for having me, Dr. Foster.
So, Dr. Mo, what is the most common misconception about women and heart disease?
Wow, that's a great question, and that's that heart disease in women is the #1 cause of death in women, just like it is in men, and that we're really working hard as a community of physicians and healthcare specialists to raise awareness about this.
So what are the signs and symptoms of a heart attack in women, and are they different from men?
Well, they can be both very similar, the classical sensation of pressure and heaviness on the chest, pain going into the jaws, but they can also be very different. Women might feel persistent, unremitting nausea, might feel dizziness, a feeling of almost blacking out or passing out, in addition to those characteristic features. So if you're having these symptoms as a woman, you should really go ahead and discuss them with your physician.
What risk factors are associated with heart disease in women?
Well, it's very similar to what a gentleman might experience. It's about knowing your numbers, learning about things like high blood pressure, cholesterol, diabetes, family history of heart problems, or smoking cigarettes. These are all classical risk factors.
So for women who are at risk for heart disease, what can they do next?
I think the first thing is, once you identify that you have risk factors, is really working hard with your physician to mitigate these and to minimize the likelihood they can go ahead and affect your risk of future cardiac problems.
Dr. Mo, thank you so much for joining me and sharing this information.
Thank you for having me.
We invite you to take a free heart risk assessment online at baylorhealth.com/heart.
Baylor Healthcare System paid for this segment.